Let's break down compounding and hazardous drugs. What is compounding? Compounding is when a pharmacist prepares a customized medication for a specific patient. This can mean altering the dosage form, removing an allergen, or combining ingredients not available in a single product. There are two main types of compounding. Non-sterile compounding, for oral capsules, creams, ointments, or suspensions, done in a clean designated area, not sterile. Follow guidelines in USP 795. Sterile compounding, for injections, eye drops, or IV bags. These must be done in a sterile environment. Follow guidelines in USP 797. What are hazardous drugs? Hazardous drugs are medications that can harm healthcare workers who handle them. These include chemotherapy drugs, hormonal medications, some antivirals and immunosuppressants. Handling these drugs requires extra precautions. Hazardous drugs are listed in the NIOSH, National Institute for Occupational Safety and Health, Hazardous Drug List. Let's interpret USP terms. CSPs, aka compounded sterile preparations. Medications prepared in sterile environments, e.g., IV solutions, eye drops. Governed by USP 797. SVPs, aka small volume parenterals. IV solutions, 100 ml LVPs, aka large volume parenterals. IV solutions, 100 ml PPE, aka personal protective equipment. Gloves, gowns, masks, and more to protect you during compounding. PECs, aka primary engineering controls. Sterile workspaces like LAFWs, aka laminar, airflow workbenches for compounding. CPECs, aka containment primary engineering control. Specialized equipment like BSCs, biological safety cabinets for hazardous drug compounding. SEC, aka secondary engineering controls. Controlled rooms housing PECs, ensuring clean air and safe environments. CSEC, aka containment SEC. SECs with negative pressure for hazardous drug safety. CA, which stands for Segregated Compounding Area, is a designated area for compounding where non-sterile preparations are made, but it doesn't meet the standards for full clean room environments. CSCA, which stands for Containment SCA, is a specific type of SCA for compounding hazardous drugs. CAI-D, which stands for Compounding Aseptic Isolator, is a type of enclosed glove box used for sterile compounding. It provides a controlled environment for making sterile medications. CACI, which stands for Compounding Aseptic Containment Isolator, is similar to a CAI, but designed specifically for compounding hazardous drugs. RABS, which stands for Restricted Access Barrier System, is a system combining a physical barrier with glove ports for aseptic compounding. It provides a controlled environment to protect sterile products from contamination. CSTD, which stands for Closed System Drug Transfer Device, is a device used to safely transfer hazardous drugs from one container to another without exposing the worker or the environment to the drug. CVE, which stands for Contamination Control Environment, is an environment designed to prevent contamination during the compounding of sterile or hazardous drugs. ISO air quality inside the primary engineering controls, PEC, ensures a sterile environment for compounding medications. The ISO classification defines the cleanliness of the air, based on the number and size of particles allowed. For sterile compounding, Class 5 air quality is required, meaning no more than 3,520 particles per cubic meter. PECs maintain this by using HEPA filters to remove harmful particles, ensuring the air is clean and free of contaminants. This helps protect both patients and healthcare workers during compounding procedures. Moving on to positive pressure, non-hazardous environments are used for compounding non-hazardous medications. In these environments, the air pressure inside the compounding area is higher than the outside, which helps prevent contaminants from entering. This is especially important when preparing sterile medications. The positive pressure ensures that any air leaks push clean air out, reducing the risk of contamination from the surroundings. This type of environment is commonly used in sterile compounding areas that handle non-hazardous drugs, maintaining a safe and sterile workspace. The National Institute for Occupational Safety and Health has a hazardous drugs list, identifies drugs that pose a potential risk to healthcare workers due to their ability to cause cancer, reproductive toxicity, organ damage, or genetic mutations. These drugs require special handling to minimize exposure. Medications on this list include chemotherapeutics, chloramphenicol, fluconazole, voriconazole, isotretinoin, dutasteride, finasteride, paroxetine, exenatide, liraglutide, lomitapide, ribavirin, ivabradine, spironolactone, dihydroergotamine, ciprasidone, mifepristone, misoprostol, warfarin, cidofovir, ganciclovir, valganciclovir, dronedarone, abacavir, entecavir, zidovudine, dexrazoxane, pamidronate, zoledronic acid, colchicine, deferiprone, metimazole, propyltiuracil, temazepam, triazolam, apomorphine, razagiline, azatioprine, acitretine, leflunomide, fingolimod, teriflunomide, cyclosporine, mycophenolate, tacrolimus, sirolimus, clobazam, clonazepam, carbamazepine, oxcarbazepine, eslicarbazepine, phenytoin, phosphenitoin, divalproex, topiramate, zonisamide, vigabatrin, ambrisentan, bosentan, macitentan, riociguat, androgens, estrogens, progesterones, oxytocin, dinoprostone, ulipristal, SERD, and SERMs. All right, let's dive into the concept of negative pressure clean rooms and why they are critical in handling hazardous drugs. Imagine you're in a pharmacy preparing a chemotherapy medication. These drugs are life-saving for patients, but they can be harmful to those handling them. That's why we use negative pressure clean rooms to ensure the safety of healthcare workers and prevent contamination. What is a negative pressure clean room? A negative pressure clean room is a specially designed space where the air pressure inside the room is lower than the air pressure outside. Why? Because air always flows from areas of higher pressure to lower pressure. This setup ensures that if there's any accidental release of hazardous drug particles or vapors, they are contained within the room rather than escaping into surrounding areas. How does it work? The clean room is equipped with a ventilation system that pulls air out of the room and filters it through a series of high-efficiency particulate air (HEPA) filters. This constant suction effect keeps hazardous substances contained. To make it simple, think of it like a vacuum seal. Everything inside stays put, and nothing gets out. The negative pressure clean room acts as a barrier. It protects the people outside the room from exposure. It ensures a controlled environment for safely preparing hazardous medications. Key features of a negative pressure clean room. Airflow direction. The airflow moves inward from surrounding areas into the clean room, preventing hazardous particles from escaping. HEPA filters. These filters trap and remove harmful particles from the air before it's vented out safely. Monitoring systems. Continuous monitors check the room's pressure to ensure it stays negative. If the pressure drops to unsafe levels, alarms will alert staff. Segregation. The clean room is isolated from other areas, and access is tightly controlled to minimize contamination risks. So to summarize, a negative pressure clean room keeps hazardous drugs contained by maintaining lower air pressure inside the room. It protects healthcare workers and the environment by preventing harmful particles or vapors from escaping. Key elements include HEPA filters, controlled airflow, and continuous pressure monitoring. Hydrophilic lipophilic balance, also known as the HLB, is a numerical scale ranging from 0 to 20 that measures the balance between the hydrophilic and lipophilic portions of a surfactant. Pharmacists usually rely on published HLB values rather than calculating them from scratch, But here's the gist. The HLB is derived from the ratio of hydrophilic to lipophilic groups in the surfactant molecule. More hydrophilic groups equals higher HLB. More lipophilic groups equals lower HLB. For mixtures of surfactants, you can calculate the required HLB by taking the weighted average of the individual surfactants' HLB values. Emulsification determines the correct surfactant for stable emulsions, prevents phase separation. For solubilization, a high HLB surfactants help solubilize lipophilic drugs in aqueous systems. Detergency. Surfactants with high HLB values are effective detergents for cleaning equipment or containers. So to recap, hydrophilic-lipophilic balance. The HLB number measures the hydrophilic-lipophilic balance of surfactants on a scale of 0 to 20. It helps determine the best surfactant for forming stable emulsions. Use low HLB values for water in oil emulsions and high HLB values for oil in water emulsions. And lastly, be familiar with ranges and practical applications for different HLB values. Moving on to excipients, to be avoided in patients. Alcohol excipients should be avoided in children with phenylketonuria. Aspartame should not be used in patients who are not able to metabolize phenylalanine. Gelatin should not be used in vegetarians, vegans, or anyone who wish to avoid pork. Gluten should be avoided in patients with celiac disease. Lactose should be avoided in patients who are lactose intolerant. Preservatives should be avoided in neonates. Sorbitol should be avoided in patients with IBS. Sucrose should be avoided in patients with diabetes. And lastly, xylitol should not be given to dogs. Now let's review the use of suppositories. Starting off with vaginal suppositories. These are used to treat conditions inside the vagina, such as a candida infection, or conditions related to the female reproductive system, such as HRT, for menopausal symptoms. Rectal suppositories are used either to treat a local condition, such as hemorrhoids or distal ulcerative colitis, or treat a systemic condition, such as pain and fever in a patient who cannot take medications by mouth. And lastly, for the base of suppositories, they must be hard enough to be briefly handled, but soft enough to melt easily once inserted. Storing suppository in the refrigerator can make insertion easier. Today, we're diving into a topic that's super important for compounding pharmacy: beyond use dates, or BUDs, for non-sterile compounded products. Let's break it down into simple terms so you can feel confident come exam day. First things first, what is a beyond use date? It's the date after which a compounded preparation is no longer safe or effective to use. Unlike expiration dates, which come from the manufacturer, BUDs are assigned by the pharmacist based on guidelines provided by USP 795. Think of it as a way to ensure patient safety by preventing the use of unstable or contaminated products. For non-aqueous formulations, the beyond use date is no later than 6 months. For water-containing oral formulations, the beyond use date is no later than 14 days. And for water-containing topical or dermal formulations, the beyond use date is no later than 30 days. Next, we're tackling an important concept: compounded sterile preparations, or CSPs, and how to determine their risk levels. This is a high-yield topic, so let's simplify it and get you ready to ace those questions on the exam. CSP risk levels are classifications used to assess the potential risk of contamination when preparing sterile products. These levels help guide proper preparation techniques to ensure patient safety. The risk levels as defined by USP 797 are low risk, medium risk, or high risk. Low-risk CSPs are the simplest to prepare. Here are the key points. They are made using 3 or fewer sterile ingredients. All manipulations occur in a sterile environment, like an ISO Class 5 hood. Examples include simple IV admixtures like saline with a single drug. Beyond use dates is 48 hours at room temperature, 14 days refrigerated, and 45 days frozen. Medium-risk CSPs involve more complexity. They have more than 3 sterile ingredients are combined. There are multiple steps or prolonged manipulations, increasing the risk of contamination. Examples include parenteral nutrition or batch-prepared sterile products. Beyond use dates is 30 hours at room temperature, 9 days refrigerated, 45 days frozen. High-risk CSPs are the most dangerous if not done correctly. They involve non-sterile ingredients or sterile ingredients that are exposed to non-sterile conditions. Require terminal sterilization like autoclaving to ensure safety. Examples include preparations made from non-sterile powders or in environments that don't meet ISO standards. Beyond use date is 24 hours at room temperature, 3 days refrigerated, and 45 days frozen. Here are the tips you need for exam success. Memorize the definitions and examples of low, medium, and high-risk CSPs. Know the BUDs for each risk level: room temp, refrigerated, and frozen. Pay attention to keywords in questions like non-sterile, batch preparation, or 3 or fewer ingredients. And understand that improper environment or technique escalates the risk level. Outside of a clean room, ISO 5 PIC is in an SCA and CCSCA. For beyond use dates for sterile compounded products, for CSP risk level of low, you have 48 hours for room temperature, 14 days in the fridge, and 45 days frozen. For medium risk CSP risks, you have 30 hours at room temperature, 9 days in the fridge, and 45 days frozen. For high CSP risks, you have a beyond use date of 24 hours in room temperature, 3 days in the fridge, and 45 days frozen. For low-risk CSPs prepared in ISO 5 PC or CPEC, in an SCA or CSCA, otherwise not in a clean room, the beyond use date for room temperature is 12 hours, and the fridge beyond use date is 12 hours. For immediate use, you have 1 hour to use it.